Katie, I'm going to be your nurse today. I am from Hand Hygiene, closing the door for patient privacy. Can I have your name and date of birth, please?
Joanne Peterson, 1210XX.
Perfect, and that matches her wristband. I am just going to open up your chart, okay? It does look like you are here for hypertension, is that correct?
Yes.
Okay, and you don't have any allergies or anything?
No.
Perfect, and you are still of full code status?
Yes.
Perfect. I am just going to perform some vitals on you really quick, is that okay?
Yes.
Perfect. Performing vitals, everything is within normal limits. Blood pressure is considered high. Okay, my dear, you do just have a little bit of high blood pressure, and I do see that you have metoprolol ordered for 7:30. That is to help lower that blood pressure. Is that something you'd be willing to take for me today?
Yes.
Perfect. And just so you know, after you take it, sometimes people feel a little dizzy, or they get something called orthostatic hypertension, which means basically if they move too fast, they get a little lightheaded. So if we just try to move a little slower when we're turning in bed, that should not be an issue. But if any of those occur, you would let me know right away.
Yes.
Still sound okay?
Yes.
Perfect. I will go grab that medication.
Thank you.
Of course. Performing hand hygiene, closing the door for patient privacy. Going into the med room. So she has metoprolol ordered for 50 milligrams. We can see that here. One pill is 50 milligrams oral. It is not expired, so we are good there. We know that the doctor did order it orally. It is for the right patient, and it is ordered at 7:30, so it is the correct time. So it is for Joanne Peterson, who was born on 12/10/XX. So we are good there, and she does have high blood pressure, which is the indication for the metoprolol. Okay, well, you will do a second med check right here. So it is for Joanne Peterson, born on 12/10/XX, for metoprolol for her high blood pressure, which is the indication, 50 milligrams orally taken, and it is the right time because it is ordered for 7:30 once daily. Hi, Joanne. Performing hand hygiene, closing the door for patient privacy. I have that metoprolol for you, okay?
Okay.
Can I have your name and date of birth again for me, please?
Joanne Peterson, 1210XX.
Perfect. That matches her chart and the medication ordered. So I'm just going to scan her wrist. I'm going to scan your wristband, okay?
Okay.
And I'm scanning that wristband, which helps with that third medication check. It is a patient match, and scan the medication. And it is a patient and medication match for the metoprolol, 50 milligrams, due at 7:30 by mouth orally for Joanne Peterson, who was born on 12/10/XX. Are we still good to get that metoprolol for you today?
Yes.
Perfect. Putting on gloves for the protection of the medication, opening it, giving it the med. So we are going to sit you up, okay, my dear? So we have that metoprolol. And some water to wash that down. Does it feel like it went down okay?
Yes.
Okay, we'll just sit up for a second just to make sure, and I'll ask you again. How do you feel?
Good.
Okay, we can lay on back down. Bed is in the lowest position, side rails are up, brakes are on, and call light is within patient reach. For the right documentation, I will press administer medication, enter my initials of KK, save it, and it is correct in the MAR that it has been given at 7:15, 50 milligrams of metoprolol. Okay, my dear, if you feel any of those side effects, please let me know right away, okay?
Okay.
Is there anything else that I can do for you right away?
No.
Perfect. I will check back in on you in about an hour, okay?
Thank you.
Performing hand hygiene, closing the door for patient privacy. Coming back about an hour later. Hi, Joanne.
Hi.
Performing hand hygiene, closing the door for patient privacy. How are you feeling, hon?
Good.
Can I have your name and date of birth one more time for me,
Joanne
please?
Peterson, 1210XX.
Perfect. I am just going to take those vitals again just to make sure that the metoprolol worked how we wanted it to, okay?
Okay.
Performing vitals. Everything is within normal limits, including the blood pressure, which has decreased into within normal limits. So it does look like that metoprolol worked how we wanted it to. Are you feeling any of those side effects I talked about?
No.
Okay. If you do end up feeling any of those, or if you need anything, don't be afraid to let me know, okay?
Okay.
I'll check in on you again later. Have a
Thank
good day.
you.